Hola, bienvenidos a Colores Latinos. Colores Latinos es un programa diseñado exclusivamente para los hispanos. En Colores Latinos, como ustedes bien saben, discutimos temas de salud, educación y cultura. Hoy tenemos una invitada especial, Dorcas Grigg-Saito, who is the director of the Lowell Community Health Center. Dorcas, welcome to Colores Latinos.
Thank you. It's a pleasure to be here.
Thank you. Como ustedes bien saben, Colores Latinos es un programa bilingüe, entonces hoy vamos a tener una entrevista con la directora del Lowell Community Health Center, el cual acaba de abrir sus puertas en diciembre de 2012. Dorcas, again, welcome to Colores Latinos. It's a pleasure to be here with you. And we invite you because we would like to understand here in Lowell and other communities about the success that you have and the Lowell Community Health Center has as one of the best community health centers in the nation. So my first question to start is, could you please explain us how do you achieve that success?
Well, on the national level, we were recognized by the Office of Minority Health and the federal government for our cultural competence. And for us, that is a very high priority to provide both cultural and linguistic access to our services. Given the very diverse population of Lowell, we really can't do our work unless we're paying attention to that.
Excellent. And I remember when we started to talk about in the pre-production that the Community Health Center now has a new building, and before you were located in like 4 or 5 different clinics. Can you explain to us why was the need to have one site, and how was the process for you for the whole center to understand that need,
right,
and how that can benefit the patients?
Well, I've been at Lowell Community Health Center since 1997, and at that time we were serving about 9,000 patients a year. Over time, we've doubled and tripled and more than quadrupled the number of patients that we're seeing each year. So we added 2 new sites over in 2000 on Warren Street and our Meyitang Health Center, which is a Southeast Asian focus center. And we added evening hours, Saturday hours, but we still didn't have the capacity to meet the demand for our services. Our services are mainly primary medical care, behavioral health care, which is mental health and substance abuse treatment, and community health programs. So over time, it became very clear that we needed to expand because we weren't able to meet the need, and that it was very confusing to the community to have all of these different sites, and you had to go to one site for one thing, another site for another. So we started our process of finding a place where we could combine all of our sites, almost all of our sites, and expand the number of exam rooms so that we could hire more doctors, nurse practitioners, physician assistants, and mental health clinicians.
So now, could you please let us know more about the inside of the new building? Like, what is the difference now between the new building and other offices that you have outside? And how many patients? Because you mentioned at the beginning that before you were serving around 9,000 patients. That was a long time ago, perhaps like 10 or 15 years ago. But now, how many patients are you serving in, how many rooms? And do you have new physicians, new programs, now that you have a nice and better building?
Right. So in 2011, we started the process of renovating an 1880s mill building on Jackson Street.
Okay.
And so there are 100,000 square feet in 6 floors, and that's about, more than twice the size of the sites that we had before. In terms of exam rooms, we've more than doubled the exam rooms to about 77 now. And when you have more exam rooms, you can hire more doctors, medical providers, and behavioral health providers. So before, we weren't able to hire new medical providers because we didn't have enough exam rooms, and now we do. We've also added some new services. About a month ago, we opened a pharmacy in the building, And we're slowly adding some time of specialists to see patients at the health center so that our interpreters are available. We can help people with their health insurance needs, and that's making access to specialists a lot easier. We also have kind of a same-day service. It's not exactly urgent care, but if people feel a need to be seen on the same day, they can contact the health center and be seen by a nurse practitioner, or a physician who can help decide, do they need to be seen that day, or can they get an appointment for a few days later?
So how many patients do you think that now that you have this new building, you can serve in comparison to the 9,000 that we were seeing before?
Right.
How many patients do you think that you are serving now?
Yeah. So now we're serving through at least one of our many services almost half of Lowell's population of 105,000. So we're seeing 1 in 2 Lowell residents through one of our services.
And one of the reasons I think why this community health center in Lowell, and we are very privileged to have this community health center here, is that you are serving like multilingual community, and I read and you have like interpreters, and you are serving in more than 25 languages. Is that right?
Right.
Can you explain us more about the process in order to be able to provide services in 25 languages? And can you let us know what are the most highest or toppest language that you are serving?
Yeah. So we now have about 320 staff, and over 50% of our staff are bilingual, bicultural in one of the common languages of Lowell. But as you said, they speak over 25 languages.
Yeah, but when you say excuse me to interrupt you, but
Sure.
when you say about the multilingual, multicultural, and the language that we most speak in Lowell, what languages are those?
Right. So the most common languages are Khmer, the Cambodian language, Spanish, Portuguese, Swahili, French, and so the Swahili and French are for people from a number of different African countries. And more newly arrived refugees are coming from Bhutan, Burma, where there are many different languages, and Iraq, in addition to a number of African countries from which refugees come.
Excellent. I think that this is a great opportunity to let people know then how important, and I definitely have to applaud what are you doing, because I come from a health environment also, and I do understand how important it is to serve the population in the language they're used to talk, because I think that sometimes when the patient has somebody who speaks the language and understands the cultural and the other values that perhaps we don't understand because we are coming from a different culture, I think it's very important and unique to have the services in their language.
Right.
Because they are more, I think that they are able to express more what's going on. And on the other hand, I think that that's one of the major keys that you have as one of the best health centers in the nation. Because I can go to Boston, and of course, those huge hospitals in Boston, they are offering interpreters in different languages, but still, sometimes I think that we still have some gaps.
Sure.
And we still have some gaps. Getting back to the health center, you mentioned something about that you are helping people with the health insurance, and I would like to ask you, now that we have the new act that we have to have insurance and it's nationwide now, how is affecting this to the low-income communities here in Lowell? Some people can afford, some people cannot afford.
So in Massachusetts, I'm sure you know, we have sort of had the same system that will be nationwide. And what we've seen for our patients at the health center is that we used to have 25% of our patients were uninsured, and now it's down to 8 or 9%. So it's been extremely effective. We have what we call health benefits counselors who provide assistance to people who are uninsured and low income to sign up for one of the government-sponsored products that are available, and they are affordable for low-income people, but it's a somewhat complex system to navigate. So our staff help our patients to kind of navigate through the system, help them to sign up, and for the small percentage who are not eligible for one of those health insurance products, health centers and hospitals in Massachusetts get reimbursed for care through what's called the health safety net. So we help people to sign up for that as well.
Let me ask you this. For example, when we have patients, because I understand that some patients, we have so many insurance, health insurance. You just need to call to CVS and for a prescription, and when you call the pharmacy, it doesn't matter what pharmacy are you calling, the answer is, welcome to so-and-so pharmacy. We are happy to work with more than 5,000 health insurance. So when you had that message, it's interesting
How
because
could there be 5,000?
5,000 different insurance. So my second question here about insurance is, I know that sometimes people can have like a different insurance, especially if people are immigrants, applies a different story. Sometimes if you just just come from a different country and you just arrive to United States, perhaps it depends your situation. You can have a health insurance that can cover just emergencies. And if you have the need to have a surgery, the patient has to, come with 70% or 80% out of the pocket for a surgery, something like that. How the community health center guide or navigate those type of issues, and how do you orient people to get access for emergencies, but also to get access for other issues, like major issues like surgeries? How that component can affect the patients?
Most of the health insurances that we help our patients sign up for, become eligible for, are insurances that cover more than emergency.
Okay.
There are frequently complications in hospital situations where some things are covered by an insurance or the health safety net and some things are not. So we try to help people understand that. Sometimes we refer people to hospitals in Boston because they have more availability of coverage for some of the things that may not be eligible here.
Okay, so but you're still working with the patient to find
Right.
out, routes or ways to get access.
Exactly.
Now, getting back to the health center and the opening, I would like to ask you about funding and how much it costs to open a building like that. How much was that for the community and for the health center?
Okay. The renovation of the 1880s mill building was about $42 million. And there were a fairly complex set of financing that we were able to tap into for the building. And I would say that our first real push forward was when we received a stimulus grant from the federal government. So during the time that the effort was being made to stimulate the economy, there were special grants that were made specifically to community health centers. So there was over 600 applications for the funding, and only 65 health centers got the funding. And we were very fortunate to receive $9.4 million for that renovation, and then another $900,000 for renovating our Meyitang Health Center, which is our Southeast Asian Focus Center. The other sources of funding were what's called tax credits, and there are new markets tax credits and historic tax credits that funded another large portion of the $42 million. And we, for the first time, had a fundraising effort, a capital campaign with a goal of $5 million. And we started with our own employees, who 90% of our employees donated to the campaign and contributed over $350,000 to the campaign. Our board of directors, which is majority people who use our services and are therefore usually low income, 100% of the board gave to the campaign. That was very impressive to people in
Definitely.
the community, to families, to foundations. And so we raised the rest of the $5 million from individuals, families, and foundations. When we started out, we had basically no list of donors, which is unusual to start a capital campaign that way. And by the end of 18 months, we had achieved our $5 million goal and had 1,400 donors. So we're very pleased that the community opened their arms and their pocketbooks to the health center.
Definitely, and I think that this is a very, it's a surprise than how the community now is responding, and it's important to understand and how the community is getting involved also in the different changes and movements in the towns, and especially in Lowell, then we are so rich, having multicultural and a lot of services and access to a lot of good things here in Lowell.
Right.
I think that this is one of the good things that we have in this area. And going back to the community health center, what do you think that we have to learn, or other health community centers, perhaps not to learn, but what is the best way to share with others your success, and how do you think that they can achieve something like that? What is the most important components that others, clinics and community health centers, has to pay attention in order to reach a success like that?
I think probably the most important priority is involving the community in planning and understanding both the health status indicators in the community, so the health issues in the community, the strengths of the various parts of the community, and setting a priority for cultural and linguistic access to care. And that often includes what we do in the community as opposed to what we do within the walls of the health center.
Now that you mentioned the health indicators, I was reading in the website you have that unfortunately, even though we have a successful investment in services in the community in Lowell, I learned that unfortunately we still have some higher numbers in like a stroke, some diseases like having a stroke, hypertension, and diabetic.
Right.
So what are you doing in order to reduce or educate the community in this matter?
Yeah. Well, a big part of our mission as a community health center is to look at disparities in health and disparities in health care that may be different for certain racial or ethnic groups compared to, say, American-born Caucasian populations. And in doing that, we do look at what is different for Latinos or Cambodians, and how can we best address those differences as a health center. So you gave good examples. For Latinos, the diabetic rate is about 3 times that of the general population. And there are higher rates of hypertension, strokes, other cardiovascular diseases. That's also true for Cambodians. And within the health center, as we've talked about, we try to make sure there's cultural and linguistic access to health care and to mental health services. And we have a diabetic nurse educator who works with bilingual, bicultural community health workers who speak Spanish, Portuguese, and Khmer, and helps individuals and families understand how to best manage their own diabetes, their hypertension, looking at nutrition, looking at healthy activity. And in the community, we have provided avenues for people to get exercise as a group. We've had walking groups for Spanish-speaking people and Portuguese-speaking people. And so we try to look at the whole continuum of care that helps to make people healthy. And part of that is what you do yourself in terms of nutrition and activity.
Sounds great. About the programs you are mentioning, perhaps we can invite some of the team, the persons that are working in your team to the Colores Latinos TV to discuss, other issues like diabetic or how to prevent a stroke.
Right.
Because
one
of the components of Colores Latinos TV is that we not just educate the community, but we like to share and to let them know what resources are out there and if they how can they access to that. So from now I'm inviting the Community Health Center to participate with us and to get involved in the show so we can spread the word about the programs you have.
That's great. And we would like to invite the community to come to the health center, get to know the health center. We are taking new patients, and we take most health insurances, maybe not 5,000 like CVS. And we are having monthly tours for people who might be interested in learning more about the health center. Our next one is this coming Wednesday, June the 26th at 4 o'clock. And then we have one in July, which is July the 24th at 4 o'clock at 161 Jackson Street, which is where our new center is. In front of our new center, we have our Meyitang Health Center, which is a Southeast Asian focus center and combines Eastern and Western approaches to mental health and primary medical care. So we invite people to visit us as patients and also to come and learn about the health center. Part of our current fundraising is an annual fund called the Wraparound Fund, and this will help us to serve people with services that are not paid for by health insurance. They include health screenings in the community. They include helping people with their health insurance. Many times people come to us and they don't have enough food in their house and they don't have jobs and they need help with housing. So we help them navigate getting to resources to help with that. So these are the things that we're raising money through our Wraparound Fund.
Can we have some phone number or website where people can visit? And for example, if people are interested to have the tour and they want to learn more about it, do we have a phone number that you can share with us?
Yes.
And what is
the website is www.lchealth.org, and there's information on there about the Wraparound Fund and about tours, or you can call 978-746-7891 for that information.
Excellent.
I can also give the main number of the health center.
Yes, please.
Which is where people who want to become patients of the health center can call, and that's 978-937-9700.
Well, Dorcas, thank you so much. It was a pleasure to have you here today.
It's great to be here, and thank you for this wonderful service to the community.
Thank you so much. I just want to let you know, and I just want to share with our audience that Colores Latinos is what we have our first year in the air, and we are serving more than 30 local towns. We are serving in different local channels in 30 towns around the New England area, and also we are in New Hampshire. And thanks to internet, we are sending the show to Guatemala, Colombia, Honduras, Venezuela, and other countries. So I just want to thanks to everybody for the support, and thank you again for being with us. And I hope to invite your team to participate with us in different languages for our community.
We would love to.
Thank you, Dorcas.
Thank you.
Thank you. Recuerde, usted está viendo Colores Latinos TV, un programa diseñado exclusivamente para los hispanos. Enseguida volvemos. Gracias. Hola, bienvenidos a Colores Latinos. Colores Latinos es un programa diseñado exclusivamente para los hispanos. Como ustedes bien sabrán, en Colores Latinos hablamos temas de salud, educación y cultura. También queremos informarles que Colores Latinos está de manteles largos. Estamos celebrando nuestro primer año gracias a todo el esfuerzo y apoyo de las personas que nos sintonizan. Hoy en nuestro segmento de cultura tenemos dos invitados especiales. Tenemos a Miguel Mendez y a Pierre Meyitang. Bienvenidos a Colores Latinos.
Gracias, muy amable.
Gracias. Hoy vamos a estar hablando sobre arte y cultura. Tenemos a Miguel y a Pierre, que son artistas locales residentes en Malden, si tengo entendido.
Sí, yes.
Pero ellos hacen, pues ellos viajan a diferentes áreas para promover el arte que ellos producen. Y para empezar con nuestra primera pregunta, quisiéramos saber, Miguel, cuéntanos de estas lámparas.
Ok. Las lámparas comenzaron a hacer en noviembre del año pasado, porque prácticamente con la economía nosotros queríamos hacer algo diferente y regalarle a las personas que conocemos en días especiales, cumpleaños y todo eso. Y siempre he querido hacer algo único para que lo recuerden a uno especialmente, ¿no? Entonces empezamos a hacer las lamparitas porque en el restaurante donde yo trabajaba yo veía de diferentes tipos de botellas que me gustaban, me llamaban la atención, y yo siempre he tenido la intención de hacer algo con eso. Poco a poco empezamos a pensar cómo podíamos hacerlo, y cuando estábamos hablando con él, yo fui a la tienda, a Michael's, que es una tienda de crafting, que tiene muchos artículos para hacer arte, y estaba pensando en pintarlas, y yo veía en el internet, pero nunca veía lo que yo quería ver, crear algo diferente, algo único.
Y estas lámparas son únicas porque ya en un momento vamos a ir más en detalle, y tanto Pierre como Miguel nos van a explicar cómo las hacen. Como ustedes pueden observar, son botellas que yo sé que ustedes nos van a explicar, pero tienen un rediseño. Ustedes les han puesto un detalle pues particular, personal, y me imagino que mucho cariño. La entrevista, por cierto, va a ser bilingüe. Les quería avisar desde el principio porque Pierre habla inglés y Miguel español, así que vamos a tener una entrevista bilingüe. Y la otra pregunta que tengo para ustedes es, ¿ustedes creen que con estas lámparas estamos reciclando, Miguel? ¿Es parte de un reciclaje también o no? Porque entonces me explica sobre las botellas.
Sí, el reciclaje se hace y pues, también se puede registrar. Si usted tiene algún artículo, por ejemplo, plásticos o algo, se puede registrar con el estado de Massachusetts, porque también ahí le ayudan a uno, si uno le interesa, pues extender más el reciclaje para poder ayudar al pueblo a recuperar el material que se está desperdiciando. Sí, se puede hacer reciclaje porque usted puede, pues en vez de botarla, usted puede hacer algo diferente y regalarla y mantenerla como un artículo de decoración.
Okay, now Pierre, I would like to ask you, like, how that idea started. I know that Miguel says something about working in a restaurant and he wants to do something different and much better. But how you guys become together with the idea to create such a beautiful lamps in different colors? And I understand that you have a remote control, so
Yes.
I would like you to explain us, how the idea become and how you put things together, and about the control remote.
Okay, great.
Please.
We were actually at a restaurant, like Miguel said, and there were a couple of lamps that were used throughout the restaurant as decorations. But there was still some sort of personalization missing from there. Each lamp just looked plain. You could find the same lamp anywhere in any market. Miguel came up with the idea of making some bottle lamps because he's had experience doing things like that before. Now, we started looking at using marbles to decorate the bottles, to make them unique, to make them stand out. Many of the bottle lamps that are already on the market used non-energy efficient light bulbs. One of the things that I decided we should do is make these lamps energy efficient, because if you keep these on for the majority of the day, you don't want your electricity bill to go up, especially if you have 10, 20 or 50 of these in your restaurant.
And for safety needs also, right?
Yes.
I'm sure that you guys study about how safety could be to make a lamp from
Precisely.
a bottle
Yes.
across electricity. So
Yeah,
I'm sure
he's in
that
charge.
you are sure that everything is safety.
Yes, as an electromechanical engineer, I always strive to make everything to the best quality possible, as safe as possible.
Yes.
So one of the goals regarding the design of these bottles was to make them run cooler, make them functional, make them aesthetically appealing, and by a few methods that we used to achieve those goals were to use LED light bulbs. So you notice the bottles are very bright, however they use less power than typical bottles out there that use Christmas light bulbs,
yes.
right? So they're energy efficient. They run much cooler, so you can touch them, you won't get burned.
Okay.
They even have different light shows. So you mentioned the remote earlier. That remote actually is capable of controlling the light animation type that the bottle can display. So you can change colors.
Can you show us the control, please, to the camera?
Yes. So this is a control you can actually get online.
Okay.
So there's nothing too special about it. It's not a secret. You can go on any website and get these. However, the art comes in assembling the bottles. That's where you need to have some originality in your design. You need to be creative, and Miguel has that aspect. He's the one that comes up with the designs, the colors. You can see it looks very unique, and it's not something that you can find in just any store.
Definitely not, because they are very colorful, and definitely you can see there is like a brilliant idea, especially you guys putting two things together, because you are an engineer and you can figure out about the control and the electricity, and you are putting ideas about colorful and using the bottle. So I think that you have a really good combination here,
I
right?
agree. Thank you.
And also I would like to know the company, because I know that you've finally become with the company globebydesigns.com.
So yes, we have a website, Globe by Designs. You can go to www.globebydesigns.com. And over there you can see the majority of assortments that we have. We have different bottles with different colors. You can even send us an email through the website or even call and make specific requirements. So if you want your bottle shaped a certain way with specific colors or a certain design, just email us and we'll work very close with you to make that design happen. Okay,
great. And for example, how long it takes to create a lamp for you guys, and what depends on it? What depends in order to have a lamp?
It varies. It depends on the quality of the design you want, the size of the bottle. It can vary from, say, a couple of days to an entire week to make lamps, because each of them is individual. Each of them is customized. It's unique. There's no one lamp that looks like the other.
Okay.
Y no solamente eso, también lo importante en el diseño es que tal vez tú puedes terminarlo y puede ser exactamente lo que quieres, pero no es a tu satisfacción. So, yo he pasado como 2-3 semanas haciendo una lámpara y al final yo que no me gusta, antes la deshago y empiezo, y sabe que cuando le encuentra las piedritas afuera y dice, no te gustó, entonces sabe que voy a empezar otra vez. Y sí, me tardo hasta un mes haciendo una lámpara. Pero es algo que lo disfruto porque me relaja, y es algo que lo hago en mi tiempo libre. Entonces no le hago ninguna fuerza. Las modificaciones que se hacen porque es placentero.
Excelente. Al principio en la preproducción estábamos hablando sobre, por ejemplo, si ustedes, vamos a decir, si alguien pide una lámpara, lo puede hacer a través del website, y ustedes pueden, pues vamos a decir que en 2 días o en una semana pueden hacer una lámpara.
Si algo predispuesto, que yo ya sé qué es lo que con lo que voy a trabajar, sí, porque si tengo el material. Y lo único que es un poquito difícil de conseguir son las luces, porque hay 2 tipos de luces que se usan, que él sabe exactamente qué tipo de las que tenemos que usar en ese momento. Si yo tengo el material y está listo para hacerlo, se pueden hacer hasta en 3-4 días. Pero si no tengo el material, se tarda hasta 4 semanas, porque las luces vienen de diferentes países y se tienen que ordenar si no tengo extras.
Ok, entonces para entender un poco más, vamos a decir, si nosotros pidiéramos una lámpara por ser colores latinos, vamos a pedir específicos colores que son el rojo, amarillo y azul, que es de colores latinos, y amarillo, ya lo dije. ¿Qué es lo que viene de otro país? ¿Qué luces son las que vienen? ¿Este material que vemos acá, o qué es lo que viene de afuera? What do you order, like, from outside? What material?
We actually get materials from both the U.S. and from China.
Okay.
So we have the marbles, we have glue, there's different paint that we'll show you in a few minutes. And we use plastic nets to actually put the marbles, to attach the marbles on the bottle.
Oh, okay.
And we also have a wireless transceiver and a wireless remote.
Excellent.
Put all those together with some art. You can go ahead and purchase some decorations from your favorite store or have a specific design. We can even 3D print some designs.
Oh, really?
And yeah, if you want a cute little bird that can be 3D printed, we can also do that. Put that on the bottle, and add some sprinklers to make the bottle shine, a little bit of gloss, and it gives you this beautiful lamp.
Wow, beautiful.
Yeah.
And for example, the other question I have for you guys is like, how long do you have the company right now? Like, for how long do you have the company?
Yeah, the website has been on for about almost 4 months now.
Okay,
Yes.
and doing the lamps, or I would like to call it something like magic lamps, or
Well, we
you
call it
know-
lights.
Yeah.
Okay, lights.
He came up with the
Lights.
name
The lights.
instead.
See,
Yeah, we
thank
can
you for
have glowing
correcting.
lights.
Glowing
Lights.
lights. Okay,
Mhm.
so the glowing lights.
Yeah.
For how long are you doing that? Because I know that when we met a long time ago in the Colombian Festival, we talked
July.
about it, and you mentioned something about becoming with the idea to create a formal company,
Right.
right? So my question is, like, for how long are you doing the glowing lights?
Oh, well, the glowing lights, well, basically we've been doing it since November. Like I said, we started with the little designs. It had transformed to this. I didn't see even coming this, but the company, basically, we are trying to expand it to a mostly commercial in a sense, because the company has a lot of potential for like Kmart, Walmart, all those companies that have a wide range of customers that might acquire this kind of lamps.
Yes, you were saying something?
No, you took the words out of my mouth.
So, for example, the other question I have for you guys is like, do you have different size? Because I can see that you have some size in the table. We are going to see soon that, and you have other size here. So you can play with size, right?
Yes.
You can do that. And for example, how many? You were mentioning something, Miguel, before when we started about donation, glowing lights. How can you, what do you need to do in order to donate the glowing lights? Are you seeing some kind of barriers now from institutions when you want to donate the glowing lights?
Oh,
Not necessarily. I think that the design is universal. It's something that can be put in a church. You can put
Exactly.
it in an orphanage. You can put it in your living room. You can put it in your office. They basically fit anywhere. You can even see you have one on your shelf up there, and it just blends right in and just adds to the
little
beauty
decor.
of the room. Exactly.
Yeah. No, para as far as donation, yo he tenido 4 o 5 compañías que he tratado de expander el arte, y me interesa esto porque, como te digo, el arte latino es algo que es muy rico y lo veo en otros países, que es que florece, que la gente se transporta a diferentes épocas cuando ve algo bonito, ¿no? Por ejemplo, si haces un arreglo floral o haces algo que es decorativo, la gente siempre hace algo, y aparte de esto, las lámparas tú las puedes poner en tu casa y la gente va a tener algo de qué hablar, para comentar y todo eso, y hacer un tipo de apertura a una conversación. Es algo que me gusta porque lo puede tomar en diferentes formas. Ahora, con las donaciones que quiero hacer es esto. Yo he visto que hay muchos latinos acá en Massachusetts y en Boston, y en el área donde yo estoy hay muchos brasileños, hay muchos puertorriqueños en diferentes países, y no hay nada cerca de donde yo vivo que tenga este tipo de empuje. Yo quiero pues hacer eso con la compañía.
Una invitación.
Sí.
Una invitación. Ahora bien, vamos a pasar de inmediato a ver cómo hacen las lámparas Miguel y Pierre, pero antes de eso quisiera preguntarles, la otra vez también estábamos hablando de que esto es muy relajante, es un trabajo, es un arte que te relaja, entonces estaba preguntándole a Miguel y a Pierre si en algún momento en el futuro podrían dar clases.
Oh, sí, con todo gusto. Inclusive a todas las personas que saben que yo hago los glides, le digo, si quiere que le enseñe cómo se hace, yo con gusto le enseño cómo se hace, porque realmente tú pones tu música, tú te relajas en tu casita y empiezas con los colores que te gusta, y entonces tú vas edificando lo que tú quieres y lo puedes hacer las veces que tú quieras. Te puedes equivocar, puedes comenzar y puedes hacer cuantas tú quieras, y es divertido.
O sea que podemos crear y relajarnos a la vez también.
Sí,
¿correcto?
y cuando tú das un regalo como este, la gente va a saber que de verdad, tú sabes, has puesto un buen tiempo y un buen esfuerzo en esto. Y si las compras para regalar, la gente sabe que tú has pensado en algo especial para ellos.
Excelente. Bueno, entonces ahora vamos a pasar en unos segundos, nos vamos a trasladar acá a la par del estudio, donde Miguel y Pierre nos van a estar explicando sobre el arte de Globe of Lights. Y recuerda, sabiendo colores latinos, si nos quiere sintonizar, puede llamarnos al 978-710-9101. También nos puede escribir al correo electrónico de coloreslatinostv@yahoo.com. Nos puede seguir en Facebook y en YouTube. En un momento regresamos, que nos vamos a trasladar con Pierre y Miguel para aprender sobre Globe Light. Thank you. Hola, estamos de regreso con Miguel y Pierre, que nos van a explicar sobre el arte de Globe Light. Miguel y Pierre nos estaban hablando hace unos minutos de cómo hacer estos lights, magic lights, me gustaría decirle otra vez. Entonces, vamos a pasar de inmediato con Miguel y Pierre. Por favor, explíquenos sobre cómo podemos hacer las lámparas.
Nancy, bien fácil. Yo veía las botellas y me llamaban la atención los colores, y prácticamente lo que escojo, la que más me gusta. Yo tengo dos acá, y lo que hago es que usted puede conseguir, estos se llaman beads, glass beads, y esto lo puede conseguir en Home Depot, y los puede también ordenar online. Cuando usted lo pone, usted solamente le hace el hoyo en la parte de atrás. Después ya que lo ha hecho, usted puede escoger los colores. Usted puede ir a la tienda y escoger todo el tipo de colores que quieran. Hay cantidad de este material, y esto lo encuentra en AC More, o lo encuentra también online. Se llaman Glass Beads. Me gustan los colores claros porque puedo usar también diferentes colores como Glass Stain, es 3D, que es bien fácil de usar, y lo puede aplicar hasta 4 o 5 veces. Okay. Entonces usted lo puede hacer como intenso, o lo puede recalcar el color que más le gusta. Si lo puede poner con 2 colores o 3 colores, depende como a usted le gusta. Yo uso mucho el dorado y me han comentado eso también. Pero me gusta la tensión que da cuando usted usa el color metálico. Cuando yo hago la botella, ya está limpia y todo, empiezo yo, si yo quiero hacer la botella con el tipo de material que viene, y la quiere hacer así, lo único que hace es que hace la parte de atrás, y puede empezar a poner colores como quiere, le pone la decoración que usted quiere.
Okay.
Y terminarlo con la parte de acá, yo lo que hago es hacer una cobertura, y la tapadera va atrás, y se pone bien fácilmente. Usted la va buscando cuando es la que más le gusta, o lo puede poner como a usted le guste, poner los colores que quiera y pintarlo al final si le quiere. Lo que se hace prácticamente es con este tipo de Pro Strength, que es el que yo uso ahorita, que es más fuerte. Todavía estoy buscando otro material que sea más fuerte para que no se cambie con la temperatura. Okay. Entonces lo que hago yo es que el glue gun, uso este tipo de material, y con el glue gun voy poniendo cada uno de los petals o los beads, y le hago la decoración que quiera. Eso es bien fácil.
Ok. Y ahora con respecto a al asunto de electricidad,
Okay.
¿Qué es lo que necesitamos y cómo podemos hacerlo de una manera safety?
Okay.
Right? Pierre,
Yes.
please.
So, as Miguel explained to you, once you have your decoration, once you've put all the marbles on the bottle and you like the design, make sure that when you drill the hole, you drill it low towards the base of the bottle, so that when the power wire is going towards the socket, that it doesn't drag the bottle down with it.
Okay.
Now, going back to the LEDs. The LEDs that we use, you can order online. This one is a single color LED. And to start out with, you can just cut the length that you need. typically about 2 feet is fine with this kind of LED. And just grab a pair of scissors, in this case, the wire cutters right here. I'm going to use wire cutters just to cut this. So once you have the LEDs cut, you will notice that on the LED strip, you have exposed copper traces. So you can cut the LED strips exactly at those copper traces, so that if you want a 2-foot long cable or 1-foot long cable, you can have that ready. Now, once you have your LED cut, you can use a soldering iron. So you can start heating it up. Use a soldering iron, and using solder, you can go ahead and attach a red and black wire to each of these copper traces. Now, the cable I'm holding already has the 2 cables soldered to the copper traces. And all you have to do is strip the ends of the wires. Again, using your wire stripper, you can go ahead and strip the end of the wires until you expose about 1/10 of an inch. That should be fine. Once that's all set, you can use one of these little adapters here. It's called an AC adapter or an AC header adapter. You can buy these online, or you can then go on our website. We will have those posted on there, so you can also know which one to get. You'll notice that the adapter has a plus and minus on it. Make sure that you follow the orientation. So the black one is going to go in the side that has minus. Using a screwdriver, you can loosen the ends, place the cable, and then tighten it. You do the same thing for the red side. You open up the socket, place the cable, and then tighten it. Now, the reason I like using this is because it doesn't leave any exposed copper, any exposed wires. So you have a lower probability of getting electrocuted if you plug the lamp and you have kids playing around it. So it's pretty safe to use something like this. Now, once your cable is wired, you can go ahead and pass it through the lamp, right through the hole that you initially drilled.
And Pierre, this is something that it goes at the end of the lamp or at the beginning? This
At
is
the
at
end.
the end.
So
Okay,
yes.
but to open the little hole as at the beginning.
Yes. So
Step 1 is the hole.
Yeah, it's the hole.
exactly.
Step 1 is the hole.
Exactly.
Step 2 is to the decoration.
Exactly.
And step 3 is the light,
Precisely.
the electricity.
You got it.
Okay.
You're missing one step, but the
With-
fourth will be the top that you're gonna finish with.
Okay,
Like you
so
got to glue this on top of that, and the glove. And you
okay,
know,
so 4 steps.
Yes, 4 steps.
Okay, so now you are talking about go ahead, please.
Now, you can poke the wire through the hole that you cut, and the wire also has an adhesive backing, so you can peel that off if you want to arrange that light inside the bottle in a specific way. That's all up to you. Since we just have a short amount of time, I'll go ahead and just show you what it looks like at the end. But we'll have all these instructions on our website pretty soon for you to actually see.
So like I said, this is very relaxing. When we're doing this, we just enjoy the day, just do something different, like instead.
Exactly.
So once that's done, basically this is what you're gonna end up with.
So this is the final product.
Yes.
This is the final product.
Yeah.
But let me ask you about the control remote, because I'm very curious about the control remote, how you do the connection with the control remote and the electricity after
So-
you finish that step.
Yes. So there are actually 2 different kind of lamps that we have.
Okay.
There are lamps that have only a single color, which is the one that I'm currently making.
Okay.
And there's a second version that has the wireless remote, which basically also involves soldering wires, but just due to time constraints right now, we won't be able to do that. We will again have all these steps on our website pretty soon, so you can go on there, www.glowbydesigns.com, and you will see every single step over there so that you can make your own bottles, or you can even place your own orders. You know, you can have fun.
So with the control remote, it's like, for example, this light needs the remote control.
Right. Estos que tienen los controles, prácticamente lo estoy haciendo con las botellas que no, bueno, glides, con los glides que no tienen botella, porque supuestamente yo le hago el diseño y lo saco de acá, y entonces la termino para yo poder meterle esto acá atrás adentro.
Okay.
So, eso es lo que pasa, que esto va acá adentro con las que no tienen botella, como no se puede meter.
Correcto. Entonces Miguel nos estaba explicando que esta era el light que tiene un solo color y este es el light que tiene varios colores con el remote control.
El remote lo único que tiene que hacer es encenderlo y puede poner los colores que usted quiera.
Como bien nos explicó Miguel y Pierre de Globe Lights, y yo le llamo las Magic Lámparas, porque son muy bonitas, tienen que verlas, de verdad, son muy especiales, de verdad que son muy decorativas, y ellos nos han donado una lámpara hoy a colores latinos que la vamos a tener en el estudio. Queríamos pues darle las gracias a Miguel, a Pierre. Thank you for being here with us today and sharing this beautiful art. Por favor recuerde que el website de Pierre y Miguel es
www.glowbydesigns.com.
¿Qué teléfono podemos usar, Miguel, para comunicarnos?
Pueden usar el 407-408-4443.
Okay. ¿Hay otro número?
Yes, you can also call 857-998-0804.
Ok, gracias por estar con nosotros hoy en Colores Latinos.
Gracias por la invitación.
Muchas gracias. Bueno, como ustedes recordarán, estamos viendo Colores Latinos, estamos cumpliendo un año de estar en el aire gracias a ustedes. Esperamos que nos sigan sintonizando. Estamos en los pueblos de Newton, estamos en Lawrence, Haverhill, Newburyport, Worcester, Lynn, especialmente acá en Lowell. Si nos quiere sintonizar, ya sabe, puede hacerlo a través de YouTube y los canales locales. Si quiere participar, puede hacerlo escribiéndonos al correo coloreslatinostv@yahoo.com y llamarnos al teléfono 978-710-9101. Muchas gracias y hasta luego.